So, is addiction a disease? It's been a disease for a number of years. It's so much a disease that it's actually covered by the American with Disabilities Act. Did you guys know that? It's covered by the American Disabilities Act. So, not that you can get disability for it, but you have to be able to, if you self-report at work, you shouldn't get fired for seeking treatment. Now, if you're using it at work and you're found impaired at work, that's a different story. But your job should be able to be secured if you seek treatment. And there are a number of employers that are actually doing a really, really good job at recognizing this and trying to help their employees get better and then come back to the workforce. Because sometimes there's no better worker than someone who's gotten in recovery and gone back to work. Why? Because they're grateful for the second chance. So it's a disease. It's a disease that has multifacets, a lot of different parts of this disease. So many facets that sometimes I think we confuse it and make it seem almost as complicated as it really is, but sometimes not as simple as it could be. Cancer, we know what it does, right? We just say cancer, we know bad, treatment, good, hopefully not die, remission. Right? So for cancer, we want to know what the prognosis is, what our 5-year survival rate is. We want to know how far it's spread. We want to know what treatments are. We get chemotherapy remission. We want to hear the word remission. And we don't want to hear the word recurrence. Do we talk about addiction with those terms? Because those are the truly medical terms for this disease. Right? This is a disease that can be active. This is a disease that can spread. It's a disease that can be mild, moderate, severe, different levels of severity. The 5-year survival rate for heroin is not very high without treatment. And we want to put this into remission, and we don't want to hear the word recurrence. Now, when cancer recurs, everyone rallies around that patient to be able to help them. When addiction recurs, what happens? Do families rally around them? Sometimes. Do treatment centers rally around them? Sometimes. So we send a mixed message. If it's a disease, we need to rally around them and give them the care that they need. And be able to help them with this recurrence. Do we want relapses to happen? No. But if we define disease as a chronic relapsing illness, we can't not ignore that relapses are going to happen. And if they happen, we just want to be able to control them as much as possible. I'm pretty much sure that every diabetic patient I've had has eaten chocolate. But I don't fire them for that. I don't fire patients whose hemoglobin A1C, which is a measure of their 3-month blood sugar, is out of whack. So watch out if you come in with a urine drug screen that's positive for something else. Right? We have to look at this as a disease. And step back and really look at it as clinicians and providers. Say, this is a person with a disease. How do I help them with this disease? How many of the patients that you know really want this disease? None really want it. None come in and say, wow, I don't know how I got to the treatment center, but because I was just having so much fun that they just brought me here. A lot of them aren't ready to stop because they don't know how else to live. Why is that? Well, they don't know how to deal with what traumas they have or whatever emotions they have. So they're stuck. Many say that they're not getting high anymore, they're just surviving. And surviving isn't really a way to live, to thrive. So they're not enjoying it. They're causing their life to be a mess, but they don't see it. That's a disease.